Hey guys, Andrew here from East Bay Strength and Conditioning. This here is a foam roller. I'm going to show you guys a couple different drills you can work with to help eliminate lower back pain, hip pain, and knee pain. So whenever I'm working with clients and they show up, usually it hasn't been an injury. It has to do with posture or an overuse, some tight muscles that are starting to cause back pain. It could be excessive sitting. Working with a lot of desk workers, athletes that are kind of curled over in this position with field hockey, various things, tennis players with the racket. So they're all just getting into this position here. But a lot of stress is happening in the lower back. So a couple drills that we can work on. Simple foam roller, you can get these anywhere nowadays. Easy to find them right online, get them delivered right to your house. But we're going to roll on each muscle group for about 10 to 15 passes, slow and controlled movements. If we find an area of tension, we're going to work on that spot for a little bit. We can hold that area for about 15-20 seconds, or you can count a couple breaths. But very simple, we're going to start with our shoulders. So most people don't realize we get tight lats. All these muscles that are acting as rear deltoid, this upper tricep, all these muscles kind of coming across, going down, line of pull is going to come into that lower back. So we're going to work those muscles out, iron those out, typically neglected area. All right? So we're lying on our side here. First thing we're going to do is about even with mid-chest here. We're going to lie right across the roller here, so it's perpendicular to us. Leave yourself a little bit of room behind you when you roll. So we're just going to support our head here. This hand's going to go on top. We're going to roll forward. We're going to come, it feels like you're hitting your rib cage a little bit. We're on the serratus muscle here. So we can iron that out a little bit there, and then rolling back here. More of a rocking action than rolling, but if you find you can get a kind of weasel your foot around here by pushing with this foot, move your body. We're just going to go forward and back about 12 times. Go as far as you can go without falling over. So that'd be the first one. From there you can do that again, moving up a little bit further. So now we're coming just below the chest on that back side. Right? Hitting the lat on that back side. From there we're just going to shimmy this thing up, back of the shoulder. So we're going to hit right into the tricep, rear deltoid. All these muscles that are attaching right in here, there's a lot of different muscles hitting. At that one point, we go palm down, forward a little bit, we go palm up, back a little bit, explore the area, look for tender spots, spend some time where you find it. Usually when we get into where everything's meeting in this back side here, where this shoulder is coming in, lat muscles are coming in, there's a lot of different muscles attaching in this area, there's a lot going on. So you can just iron that out. If you guys feel like a numbness, tingling, get off that spot. We shouldn't be having a radiating or tingling feeling going down. Want to make sure that we're just hitting the muscles and we're not pressing on different nerves. Alright, so what we're going to do from there, after we've worked out that shoulder part, is we're going to come into our hip. So we're going to sit here right on top of the roller, both glutes right down the middle. Take one leg, we're going to kind of shimmy to the side, hang out on one side, cross this leg over. So the leg that's crossed is the side we're going to roll into. So you'll feel on your sit bone here, and then we're going to roll up above the belt line. So just above the belt line is the glute medius. We're going to roll in there. It's usually a nasty spot. You'll feel the upper edge of your pelvis if you go a little bit higher. We're going to stay kind of just below that. So work a little bit towards the spine, work a little bit towards the outside of the hip, exploring up high, exploring a little lower, just seeing where we have areas of tension. All right? From there, what we're going to do is you're going to move right to your quad. So we have this muscle here, TFL, rolling right into the outside aspect of the quad here. So we're going to start up high on the leg. I'm going to go right into those hip flexor group. I'm going to turn pelvis up a little bit. I'm going to get right onto that muscle on the side here. Usually there's a lot of discomfort in this area. So you're going to iron that area out. You might just hang out on the spot and breathe. Right, if it's really tender, and then kind of go smaller rolls, gradually getting bigger. From there, we're going to move this roller down. We can hit the upper aspect of the quad, then roll right towards the knee. One big swoop where you can break it into kind of a half swoop and a half swoop here. So depending on how comfortable you feel. So you can hit the quad straight on, and then you can turn a little bit to the outside, hitting the vastus lateralis, the outside muscle of the quad, right where it meets the IT band. If you go straight up here and you just roll along your IT band, that's just going to hurt a lot, and it's always going to hurt. It's never going to feel better. If you roll out here on the outside aspect of the quad, session after session, week after week, you're going to start to feel less and less discomfort in that area. So guys, always hit both sides. You're going to find that you might have one spot that's a lot tender than the other. We're going to spend a little bit more work there. You could count breaths, or you can count up to about 15 to 20 passes. If the area doesn't feel that bad, give it about 10 passes before you go on, because sometimes you'll start to just uncover stuff by moving up and over it. Right? Those are some easy things that you can work on, guys, just to iron the body out and get yourself mobile, feeling better, a little more loose. You'll start walking, a little more freedom. But that's just a temporary fix. It's your posture and your core stability are two things that you need to work on in order to correct the pattern. So now we're moving a little bit better. We're feeling a little loosened out, but if you guys don't correct the way you move, you don't stabilize your pelvis, you don't stabilize your shoulders, we're going to end up right back where we were. So we can keep doing that. So what we have going on, guys, we have a workshop starting the 24th, Tuesday the 24th, 7 p.m., right here in the EBSC studio.